Hello, everyone. Happy New Year's. Today, we're going to be talking about the selfie and specifically your jawline. I always get people talking about how selfies is changing plastic surgery, but it's not just the selfies, it's the filters. And one of the things that Facetune does beautifully is really define your jawline. We've known it for decades that when people take pictures, they turn, they look to the side, everyone has a better side because your jawline is more defined on one side. But how do you get that jawline without having to turn your neck so much and look silly? Because everyone knows what you're doing. Submental liposuction for me is the best option. The best options these days that are three most common are going to be submental lipo, Kybella, which is something you inject into this area right over here. And last but not least, Cool Mini, which is cool sculpting that can be done and same in the midline. Now, when it comes to defining that jawline from the side, the other two can help reduce the fat in this area and define this area a little bit more. But from the front, in order to get this jawline definition, you really have to go with a combination of liposuction to sculpt this and possibly even some fillers. Now, liposuction itself is about a 30-minute procedure. It can be done under local anesthesia. It involves 3 incisions. One's right below the earlobes that are little small incision that require 1 stitch, and then 1 centimeter incision right under the chin. Through these, I use a special technique where we run a liposuction cannula without any suction on it. This will help create a layer of scar and skin contracture that'll really help tighten the skin under the neck. And right below that, we remove the layer of fat below the skin, but above the muscles of the neck. This fat will help define your neck a little bit. Of course, this procedure is for younger people. If you're old and already have loose skin to begin with, it doesn't work so well because that scar contracture is not enough, and then you can end up with skin and hanging and nothing below. After the surgery, I usually recommend my patients to be on some form of antibiotics for a week, maybe pain medication for a day to keep your blood pressure down, and most importantly, a compression dressing for at least a week or 2 to help really tighten that skin. Other than that, it's a fairly easy recovery. It can be done for as little as $1,500, and the risks have never been defined in a study, but they're pretty minimal. The main risk being nerve injury, infection, or a blood clot, which are all things you can have from the other options. Hope you guys really enjoyed this information. Hope it was helpful. Leave any questions or comments you have below. Feel free to reach out in 2019 so you can get selfie ready. You're using Sagar Patel's aesthetics signature technique for sculpting that jawline. Take care, everyone.